I understand and accept that my primary responsibility is to my patients.
I shall dedicate myself to render, to the best of my ability, the highest standard of oral health care.
And to maintain a relationship of respect and confidence.
Let all come to me safe in the knowledge that their total health and well-being are my first considerations.
I shall accept the responsibility that, as a professional, my competence rests on continuing the attainment of knowledge and skill.
I acknowledge my obligation to support and sustain the honor and integrity of the profession.
And to conduct myself in all endeavors such that I shall merit the respect of colleagues, patients, and my community.
I pledge to continue to serve diverse populations and focus on service to my community.
I further commit myself to the betterment of my community for the benefit of all of society.
I shall faithfully observe the principle of ethics and code of professional conduct set forth by the profession.
All this I pledge with pride in my commitment to the profession and the public it serves.
In 2 short years at the College of Dental Medicine, we have created an environment for our students that's second to none.
The academic clinical experience has evolved over time. As an undergraduate in 1981, there wasn't a lot of feedback from the faculty, there wasn't a lot of student input into how things are run and the processes. That's all changed.
Training a new generation of dentists, obviously it is a big responsibility.
As an oral health educator, you need to change our approach from the past and then try to interact much more with the students.
So this has been a very exciting year for the Touro College of Dental Medicine. We've admitted our 3rd class and we've opened our clinical facility.
Our students have gone from the classroom of basic science learning and foundational knowledge to the state-of-the-art, technologically most advanced clinic that one could find in treating the patients of the lower Hudson Valley.
We are very energized to help the community. That's one of our missions here at Touro, is to provide as much health care as possible to those who need it.
They really show us the importance of making sure everyone is taken care of and being seen by doctors and being seen by us as dentists.
The Touro experience has been very good for my students, and to me, it's the best experience. And it's the best experience for them as learning dentists because they get an opportunity to really stimulate patients to care for themselves.
I had this patient, he was 8 years old, and he had melanogenesis imperfecta. We were able to treat him because we had the tools. He was just so happy, he couldn't stop looking at himself, and it made me feel great. I went home and I had to tell everyone around me how amazing I made this little kid feel.
The biggest way we're able to influence the patient experience and the care we provide our patients with digital dentistry is by applying new tools that are available to us. These tools allow us to use digital dentistry to be a better diagnostic process for our patients rather than just a restorative solution.
Here at Touro College, we have had the opportunity to work with different types of ways of assessing patients' needs. I think that with all these different technologies that we are learning when we are out in the real world, we'll be able to know how to treat people with quality care.
It's important to break the mold in building the dental education institution of the future because you want to make sure that your students graduate with tools that are relevant for the future.
One of the reasons that we've invested our time and energy in building out the digital systems at Touro is because we knew that growing it organically from the ground up gave us a lot of control and how to introduce this whole field to the student population that's here, which is really exciting because it's never been done before.
We've invested hugely in the Touro College of Dental Medicine to create state-of-the-art educational and clinical care facilities. It's an expensive proposition, and our commitment is to remain on the cutting edge of technology.
The providers that we educate today will be intimately involved in overall healthcare, not just oral healthcare, but overall healthcare. They will be part of the team of making populations healthier. We'll be focused on that as we build for the future.